I just have to share this with you, and I forget where I got it. My apologies to whatever online site this came from. Oh, Talking Points memo. There you go. Uh, the article by the writer Tierney Sneed is that healthcare under Obamacare has dramatically improved for a lot of people in this country. Uh, Let me share a little bit with you of what she wrote. Since the implementation of Obamacare picked up in the fall of 2013, Americans are reporting better health. But what about the death panels and easier access to doctors? No, all the doctors were going to go to work for the government. Remember all the filthy lies these right wingers told? This, according to a new study, but minority Americans, as well as lower income Americans, reported even greater gains than did people who don't fit into those two categories. The study noted, quote, the reduction in the uninsured rate among Latino adults was greater than the reduction among white adults. Latinos reported a reduction of 12% compared to 6% reduction among non-Latino whites. Likewise, non-Latino blacks saw a greater drop in the uninsured rate than whites. They reported an 11% reduction. In the areas of access to doctors and medicine, Latinos and blacks also made greater gains than their white counterparts. Now, the reason for that is, to me, is obvious. This may not be true, but my knee-jerk reaction is, well, of course it's better for minority groups in this country, given how little access they had prior to Obamacare. Additionally, it goes on, the study compared the experiences of those in states that had participated in the Affordable Care Act's Medicaid expansion prior to March 2015 against those in the 22 states that did not. It found there was a greater reduction, by a difference of about 5%, of the uninsured rate for those in Medicaid expansion states, as well as greater gains in access to doctors and medicine than those in non-Medicaid expansion states. So all the states that said no to the Medicaid extension that the federal government was to pay 100% of for, 3 years, then 90% forever. In addition to not participating, the governors or the legislators of those states have condemned part of their population, their state population, to illness, debilitating illness, and eventual early unnecessary death, because they ain't going to let no Negro tell them how to do health insurance. Amazing, isn't it? The study went on to say, quote, as states continue to debate whether to expand Medicaid under the Affordable Care Act, these results add to the growing body of research indicating that such expansions are associated with significant benefits for low-income populations. But who cares about low-income populations, right? For the survey, researchers from the Harvard School of Public Health, Harvard Medical School's Brigham and Women's Hospital, and the U.S. Department of Health and Human Services looked at surveys of more than 500,000 Americans, nearly 50,000 of them in the lower income bracket. So the survey was conducted by fairly reputable surveyors. It is just a phenomenon that is hard to it's hard to explain, much less to try to understand. Why the governors of certain states, when offered a Medicaid expansion that ultimately would cost them nothing, and in fact would be would increase their state's revenue by the simple fact that the federal government, would be pumping in millions upon millions of dollars to take care of health care that the states are forced to take care of now. I could not try to explain it, nor could I try to someone from not in this country, nor could I understand it myself. Why those governors or those legislatures would say, no, we're not going to do it, other than their racist, stupid, dumbass attitude that they're not going to let any Democrat or liberal or progressive or black guy in the White House who was born in Kenya tell them what to do, as though that were the case. It's just It's just astonishing to me. It's just astonishing that we have governors who are that. What's the word, Kathy? They're immune to just normal compassion. They don't feel it, empathy or compassion for the citizens in their states who desperately need medical care or nutritional support, and these governors don't care. They will condemn them to illness, the children. Now, if they were fetuses, these rancid sons of bitches would be jumping up and down to do everything to rescue the fetus from that vicious, ugly mother. But we're talking about living children, not fetuses, not cell clusters. We're talking about living children, living adults, men and women who need help for a number of reasons. And these Republican governors, even though the help in this particular instance would be offset financially by the federal government, they don't care. They're still not going to do it. They're just not going to do it. I cannot comprehend that. If you're the governor of a state, why would you deny your citizens health care? Access to a doctor if you need it. Preventive medicine. Why? Who am I asking? Hello? Anybody? Probably because these people are complete sociopaths, and I use that not in the pejorative sense, but in the clinical sense. They are sociopaths. They define themselves by their actions.